However, people are still on the fence about getting the COVID vaccine, and there are many out there who have decided they're just not getting it.
The vaccine team's Michael Delvna is going on a Verify road trip tonight, targeting some of the most hesitant communities to find out if anything can change their minds.
What used to be days of long lines and a rush for appointments are now gone as the vaccination rate has slowed.
And experts say vaccine hesitancy is playing a role here. And the reasons can be varied, from wild conspiracy theories to those with legitimate questions. So we hit the road.
Our first stop, Mill Avenue in Tempe, targeting one of the most hesitant groups, younger people. A recent survey found 21% of Gen Z says they do not plan on getting the vaccine, with more than 30% saying they will wait and see.
Nice to meet you. I'm Dr. Shad.
We brought along Dr. Shad Marvasti, Director of Public Health from Arizona. We even had a mobile vaccine clinic from Embry Health parked just feet away to administer the shot if anyone wanted it.
I'm Noah.
Aaliyah.
And I'm Dave. Already being a young guy, very low risk to get COVID and especially die from it in the first place. Why should I get vaccinated?
It's a great question. Unfortunately, you don't know before having gotten the infection whether or not you actually are low risk.
Are they 100% complete on the research?
We now have added to that data from hundreds of millions of people around the world in all age groups, right, in all backgrounds and conditions that have also shown it to be highly safe and effective.
But the most common question of all, why get it now?
Now, not everyone's going to get sick, right? But you keep spreading around, then a new variant forms, and then that eventually is something that's resistant to the vaccines. That's the problem. It mutates.
We spent hours out there answering question after question from unvaccinated 20-somethings. No one got the vaccine, as they remain skeptical.
It's just more like, I don't feel like I need a vaccine.
I guess I'm just a skeptic person.
The misinformation has really done the damage. It's really created a culture of people being really scared and hesitant. We have to get into the grassroots, we have to knock on doors.
So we hit the road again. Going door to door, this time with Dr. Ricardo Correa, an endocrinologist with the UA College of Medicine, to try and reach those in Maryvale and West Phoenix, one of the most under-vaccinated areas in the state.
That is very important is tackle the problem in the culture and the language of the population. Gracias. No, muchas gracias.
CDC data shows that the Latino population lags behind everyone else when it comes to getting the vaccine.
Porque todos los que saben acerca del virus han desaparecido.
Ser humano tendemos a creer mucho en teorías de conspiración. It will make it hard if we don't do something to convince this type of people.
The battle, Correa says, is misinformation, especially as so much of the initial correct information was in English but not Spanish.
Definitely allow misinformation to spread because they didn't understand.
Now there were some who say they got the vaccine and are now trying to convince family members and others to get it.
They say that when he got the vaccine in the fries, there was no documentation asked, and they convinced their daughters, the other friends, and everybody to go. So,
but overall,
I feel like we don't need to.
All the skepticism was clear.
We need people like you that are in that middle, like yes, no, but more yes, to go and get it.
After we talked to this man, he said he might get it and took down information about a nearby clinic.
Okay, está bien.
And time matters here.
It continues to spread among people who aren't vaccinated before we get a variant that is resistant to all the vaccines, and we basically have to start from square one all over again.
We talked to dozens of people, answering all of their questions and concerns and letting them know where to get the vaccine, and still came up short. But both doctors say this direct outreach is crucial because just one person that they convince makes a difference.
That's the challenge, and that's why we need to start a campaign empowering the people that already got the vaccine to spread the word to their neighbors or their families that do not want to get the vaccine.
Michael Delvna, 12 News.